First thing on the agenda is a request for bill introductions. Are there any? Seeing none. So today we're having hearings on 3 of the budgets within our purview. And the first thing we'll hear from is the Kansas Board of Nursing. And to start off with, then we'll get a report from the fiscal analyst, Megan.
Good morning. Oh, good afternoon. I should know, it feels like it's been 2 days in one. I'm Megan Leopold with KLRD. I'm a fiscal analyst. I'll be providing an overview of the Board of Nursing budget, and then following my presentation, Carol Moreland, the Executive Administrator of the Board of Nursing, is here to share with you as well. Starting out on page 1 of the budget analysis that you should all have. The Board of Nursing regulates the practice of nursing in the state of Kansas through 3 primary roles. They evaluate nursing schools and maintain the licensure of practical nurses. They also are practical nurses and many of the other nursing professionals. They review and approve continuing education providers and programs for the licensees and the accredited schools. They also investigate complaints concerning unlawful practices. I'm going to skip forward a few pages to page 6. On page 6, there's a summary of fiscal year 2024. You can see that the legislature, the 2023 legislature, approved a budget of $4.1 million. And this is all from special revenue funds. The agency requests a revised estimate of $4.3 million, and that's all special revenue funds as well. There's no SGF money in this agency's budget. You can see that the agency did not have any supplemental requests for fiscal year 24. However, the revised budget does include $225,000. Those are all federal funds. They were awarded through the ARPA Efficiency and Modernization Awards. These are awards that they're using, or funds that they're using to upgrade their current licensing software. This is their strategic plan for IT. It's a multi-phased upgrade approach that will reinforce security adjustments, make adjustments to improve workflow, and also streamline the process for licensees. Further below that, you can see that the governor did not recommend any changes to the agency's revised request. On the next page, you can see there's a chart that shows the changes between the actual expenditures in fiscal year 23 and the revised agency estimate for fiscal year 24. And then I'll move forward to page 9. Page 9 outlines the agency's fiscal year 25 budget request. The agency requested $4 million, and again, this is all special revenue funds and 27 FTE positions. This is an increase of $66,420, and that's due to the agency's enhancement request to continue the pay plan that was implemented by the fiscal year 2023 legislature. This is something that you're going to see in the fiscal year 25 request for all of the fee boards that come before this committee. This is because when the legislature passed the pay plan last session, this was the fee expenditure limitations were raised for the fee boards for fiscal year 24. However, they were not raised for fiscal year 25. So this is really just adjusting that expenditure level for fiscal year 25 so that pay plan can continue. So it's really just in continuation of what was implemented already in fiscal year 24. You can see that the governor did not have any recommended changes to the agency's fiscal year 2025 budget. Just to give you a picture of what else is included in here, I'll have you go back to page 5. And on page 5, you can see there's a fee fund table that shows the fee fund expenditures, revenues, and ending balance for the Board of Nursing Fee Fund. This is their largest source of expenditures. And you can also see the licensing fees. I'm happy to stand for any questions that the committee might have.
Committee questions for Megan? Representative Barth.
Thank you, Chairman Mason. Okay, let's see. We kind of go backwards to go forwards, so this makes it hard to know where we were with my questions. Okay, I have a few different questions. So page 6, you mentioned number 3 there, licensing software upgrade for the 2024 fiscal year on the nursing budget. You said this is something to do with the federal dollars, but I do not see anything where it states federal dollars on that. Oh, there is federal funds, never mind, I just now saw it, okay.
Okay.
So this is funded by the federal government, or they're saying this is state funded here? I thought I heard you said it's federally funded, but
So
requesting state dollars?
the legislature awarded through these awards called modernization and efficiency grants. This was ARPA funds, the American Rescue Plan Act. This was awarded in the last legislative session, and they were added to the fiscal year 2024 as this one-time funding.
So this ARPA went away, is that what you're saying?
It was discretionary funds that came to the state, and the legislature was able to distribute those funds however they chose. And so they awarded several of the, several state agencies awards, and they're one-time funds that you'll see show up in several budgets, actually, and then they're not recurring.
Okay, so it's not coming from the state, this is coming from the ARPA fund specifically?
Correct, it's federal funds.
Okay. And then I had another question too. Goes again to the page 8 on the fiscal year 2024. You know, we see this almost $780,000 increase, but I never heard of why we were increasing it so much.
Okay, so there are a few reasons for that. The fiscal year 23 actuals, the agency actually spent $160,000 less than what was approved for the agency in fiscal year 23. So that makes part of the difference. So the fiscal year 23 is artificially low. And then you'll also see that they had increased expenditures for contractual expenditures, for the licensing software upgrade for that $225,000 that we just spoke about. That inflates the fiscal year 24 numbers. And then there's also the state employee pay plan that was added by the 2023 legislature, and that increased the budget in fiscal year 24.
And I didn't do all the math on that, but it wasn't $770-some thousand. I thought that would be, and because you have a negative coming out of there too. Shouldn't that be closer to 3.4, not 4.3? The math is not adding up.
Well, I can show you if you want me to itemize it for you, I'd be happy to.
I would like that, please.
Sure.
Thank you.
Committee, other questions for Megan? Representative Ballard.
Thank you, Mr. Chairman. I'm looking on 4 where we talked about the increased expenditures from 24 to 25 with the Board of Nursing Fee Fund was largely due to salary increases for state employees. I know we had talked about that. And then when we move over to 5, this is something that was anticipated that I don't know if we need any more explanation, but the ending balance to decrease that 1.1 million from 23 to 25. The revenues were anticipated to decrease between 22 and 5 due to more states joining the nursing licensure compact and the agency losing licensure renewals for nurses residing in those states. I think we anticipated that we would be losing those. Mm-hmm. Okay. Is there anything else that goes with that? In other words, I think my question is, will the increase balance out that decrease?
Are you asking if with that decrease in revenue, if the agency will be able to continue moving forward? I think the agency will be better able to speak to that, but this is something that they've anticipated with the change in the nurse licensure compact. So yes, they do anticipate that that revenue will go down in future years.
I was just, that's what I know they talked about, and I thought that's now happening. Thank you very much. Thank you, Mr. Chair.
Other questions? Representative Carpenter.
Thank you, Mr. Chair. So, Megan, how many employees do they have that are state employees?
27.
27, okay. And so those 27 got the 5% statewide pay plan,
Yep.
and that equivalent to 300,000 or so.
I'm sorry, what?
Money-wise, how much was that?
Oh, the state employee pay plan? Well, the expenditure increase in fiscal year '25 was that 66,000.
Okay,
So I would imagine it would have been similar in fiscal year '24.
thank you. Thank you, Mr. Chairman.
Committee, other questions? Seeing none. Thank you. At this point, then, we would call Carol Moreland, Executive Administrator of the Kansas Board of Nursing, to the podium. Welcome.
Better? Yeah, sorry. Okay. All right. Fiscal year '24 includes phase 2 of our licensing software, and that's where we got the ARPA funds to help with that. But it'll be great once we get that done. We've had a lot of requests from our licensees that we upgrade our licensure software so they can do a lot more mobile. Everybody likes to do everything from their phone, and what we have right now doesn't work as well with mobile devices. So that's one reason that we're upgrading. So that will make our licensees much happier, believe me. We are not asking any increase in our FTEs. We actually haven't increased our FTEs since probably like 2019. So that's good. Our fee fund does support these requests. I know there were some questions about our fee fund. So I just kind of wanted to share with you, since we are a fee-funded agency and we get most of it from our licensure fees, what we've seen since we implemented the compact, because I know that was a question. What we've seen since fiscal year '21 to the end of fiscal year '23 is we lost 9,000 licensees. Now, please understand that does not mean that there's 9,000 less nurses to take care of our citizens, because that means that maybe they lived in Missouri and before they had to get a single state license with us. They don't need that now if they have a multi-state license out of Missouri, but they can still come across the state border and practice. Any nurse who has a multi-state license from any of the other 40 states that are part of the compact can come into Kansas and practice. But what that does mean for us is, of course, our revenue, we're starting to see it go down. Now, something that is happening that's helping us some is our board decided when we joined the compact that the nurses had an option to have single state or multi-state. The multi-state costs more money. There's more involved to process it. Plus, it gives them access to 41 states right now, versus if they have a single state in Kansas, they only have access to Kansas. So we are seeing most of our new graduates go for multi-state. So that makes sense. It was just very difficult for us to project how many of our own single state licensees would go for multi-state. We've seen some kick over and some we haven't, because the first year that we were part of the compact, as far as multi-state RN, we were like at 5,800. We're up to 15,000 now. So it is very popular. And it's a very good thing. It made a lot of difference during COVID in order to be able to mobilize the nursing workforce. And there's 41 states now. There's probably at least 4 or 5 other states that have legislation in process. So we're hoping to get up to 50 states very soon. So that's kind of a little bit of an explanation about our fee fund. Another thing that we're seeing is the number of graduates are down from our nursing programs. That's not really too much of a surprise. That's down for several reasons. The number of qualified applicants coming into the program are down. Clinical sites, they don't have enough clinical sites, so they can only take a certain number of students. And so that has impacted it. And then faculty. We have a decreased number of faculty for a couple of reasons. You've seen faculty retire, especially with the pandemic. They retired. And then they can make more money going to work, like for a hospital or something like that. So, unfortunately, until we're able to get the pay for faculty up some throughout the state, I think you're going to see that the faculty is going to kind of lead into that. But that is one thing that we're seeing there. We have approved 2 new nursing programs this last year, just kind of let you know kind of what we're trying to do about the nursing shortage. Doesn't really have anything to do with this, but you might want to know that. We've added 1 more licensed mental health technician program, and we're working to try to get them to partner with community colleges so that they can get credit for some of the courses that they're taking. So those are some things that we have done to kind of help the nursing shortage, just kind of FYI. Just another thing that I will add is we do encourage the inclusion in fiscal year 25, of the 5% pay increase that's in the governor's budget. It is harder and harder to get competent applicants to come and to retain our own competent. The only way that we can do everything that we do is we have our competent staff. But when we start losing them because they can make more money someplace else, that's a little bit of a problem, especially when we can't refill it. So I'll stand for any questions, if you have questions.
Committee questions for Ms. Moreland. Representative Clifford.
Do we get any of the compact fees then, as participants in the compact? Do we get some money to offset this loss of fees?
Just our licensure fees that get the multi-state from us, okay? Because whatever state they reside in is where they have to get their multi-state license. Such as I reside here, so if I get a multi-state license, it has to be from the Kansas Board of Nursing. But if I move to Arkansas and I change my residence to Arkansas, I have 60 days to change my compact license to Arkansas. So we see people moving too, moving their residence, so that affects this too.
Thank you, Mr. Chairman.
I think we may have somebody online. Representative Ruiz online.
Thank you, Mr. Chair. I have a similar question to ask about the compact. What has your staff that manage all the licenses, what have they had, how have they had to adjust to having less fees?
Okay, right now we haven't adjusted at all. We only have 4 full-time staff in our licensing, and that's what we've had for a number of years. However, they have to do more because of a multi-state license. There's 11 uniform licensure requirements that have to be met before we can issue a multi-state license. And so they have to check all of those 11. So it takes a little bit more time. However, right now, they're doing fine. They're keeping up with it. Our performance metrics, they're at 100% as far as processing these, and that's really good. Again, we've had all of that staff for a number of years. They're very competent at what they do.
Mr. Chair, I have another question.
Yes, please proceed.
Thank you. Another question is regarding any kind of, you would have had to establish a multi-state or compact commission?
Yes. Mhm.
And where is that commission? Is it in Kansas or in another state?
Every state that is part of the Nurse Licensure Compact has one commission that is on a national nursing licensure commission. And so every state has one representative. We have meetings, we have 2 meetings yearly in person, and then we meet quarterly beside that to look at rules and everything. There's subcommittees that have representation. But I hope that answers your question.
Yes, and one last question about the commission. Is there an additional fee that is charged to the licensee from the commission? Or is the state charged a fee?
No, we do not charge it to the licensee other than, I think I said that their license fee is a little bit more. Like for RN, single state's 100, multi-state is 125. Again, they can work in 40 other states on that one license. But no, we do not have any extra charges to them because of the commission. Our state, every state pays $6,000 a year to be part of the Nurse Licensure Compact.
Thank you,
That
Mr.
has
Chair.
not went up. I'm sorry.
Thank you. Committee, other questions? Representative Barth.
Thank you, Chairman Mason. I see here that there are some unfilled positions as well. Can you tell us about those?
Well, like every state agency, we have unfilled positions at times, it seems like. Right now, we have 2 full-time investigator positions. We've been interviewing for one. We have a full-time admin in the investigative division. That one's only been open for probably 2 months. We had a person who left there. We have one full-time position in our education division, and I think maybe that's it. And we probably roughly run 3 most of the time, it seems like.
Representative Ballard.
Thank you. It's amazing that you only have 3 because they can make so much money. I mean, going to other places or working a nursing shift of 12-12 or how many days a week or half can be, so it makes it very difficult to be competitive. I am really pleased about your mental health tech program because that's one of those areas that they do not have enough practicing nurses in that area in order to help. And yet we know that every state has a need for increased mental health services. So how many can you accept in that program?
Right now, Osawatomie has a program, and they've had a program for years. It kind of quit for a little while and started back up. They did not have any during COVID because their staff are the ones who teach it. So if they're needed as staff, they can't get them free to teach. I think they usually admit about 15, and it's a 9-month program. And then the other one that started is KVC, and I think they were going to start at 20. And we're hoping to be able to, there's some, I will tell you, there's some community colleges that are interested in getting a licensed mental health technician program because that way they can give college credit. And we're hoping that will be a pathway to become a nurse then. Because right now they're not getting any college credit for what they're getting at either one of those places. So we're trying to see the pathway into nursing and trying to help that a little bit.
You answered my second question about that because the community colleges would be a logical step. You know, I've looked at this program for years, and it seems to be in really good shape. And especially with that state that allows more flexibility for people to come in and out. And with only roughly $25 difference in that fee. So I just want to say thank you.
And I might just make one more comment. There was a question about whether the board's really watching the fee fund. They are. Our finance committee, which meets quarterly, it's a subcommittee of the board, looks at that every time. They don't want to raise licensure fees if they can help it. But like everybody, the more IT we have, the more faster we do things. I mean, that all costs money. And so that's kind of, but if we were not able to do that, we wouldn't be able to offer the services that our licensees want, and they would not be very happy at that point. So our board is watching that. We're not at statutory cap on most of our fees, but we're really hoping that we won't have to do that.
Representative Clifford.
Yes, thank you, Mr. Chairman, and thank you, Ms. Moreland. You partially answered my question, but the APRN $50, is that on top of their single or multi-state fee? So they are paying like $150 for a single state?
Yeah, in Kansas, we require the APRNs to keep their RN license. So yes, it's 2 fees. And APRN is cheap on here because APRN's not part of the compact, okay? They could have a multi-state RN, but their APRN is only single state.
And just for reference, physician license is about $340. So given the legislation last year, you might have some room, although it looks like statutorily we'll have to give you a new limit.
Yeah.
Thank you, Mr. Chairman.
Committee, further questions? Seeing none? Thank you very much. Next, we'll call Terry Roberts to the podium. Welcome.
Thank you. Good afternoon. My name is Terry Roberts. I'm a registered nurse, and I'm here on behalf of myself. My day job is I run a national specialty association, nursing association that is headquartered here in Topeka, Kansas. It's the American Holistic Nurses Association. Those are the mind, body, spirit nurses in our country. But I would be remiss if I did not tell you that for 23 years, from 1985 to 2008, I wore one of those lobbyist badges. Okay. I was the executive director of the professional organization for registered nurses in Kansas, the Kansas State Nurses Association. But I'm here today as someone who has monitored the Board of Nursing since 1985, been to a lot of their Board of Nursing meetings. First off, I want to thank you for serving on this committee. I know that many of the budgets that you review are for our vulnerable populations, and I know that what the challenges are for that. So thank you. I have 4 areas that I want to talk about today. The first one is the current fee fund balance for the Board of Nursing. So I was at their September meeting of the Finance Committee. That's the one meeting I try to get to. And I saw that the fee fund balance was over $5 million. And I'm like, I made a comment. I said, this is the highest fee fund balance I have ever seen since 1985 as monitoring this. So I did some numbers, and I just want to tell you that in the first 4 months of this year, this fiscal year, since July, August, September, October, the fee fund balance rose $11,000, and it rose from $4,969,000 to $4,980,000. Well, if you look at that in comparison to the KSBN budget for 2024, and I didn't have the numbers that she gave with the additional money you're adding, but it's $3,772,000. So the percentage of operating budget in the fee fund balance is 134% of the operating budget. I think that's way too high. And in fact, I would recommend that they reduce the licensure fees. That has been done in the past. Or support additional funding to our impaired provider program. I'm sure they could use the money to help with those licensees who are trying to get back on track from addictions. And lastly, if they don't like any of those ideas, they can support the Kansas Nursing Workforce Center that is currently housed at the KU School of Nursing. The second area I want to talk about is only tangentially related to this Board of Nursing budget, and it's the K-TRACS funding. K-TRACS is funded out of the Board of Pharmacy, but in its early inception, 17, 18, 19, 20, the Board of Nursing had to use fee fund money to pay for K-TRACS to be brought up. K-Trax is a tracking system for pharmacists and others for when they dispense medication, so they can see if there's a pattern of practitioners writing Schedule II drugs for essentially trying to reduce the opioid epidemic. I believe that, and I've been at the national level, been monitoring the opioid settlements state by state. Remember, I'm connected with all the other national nursing organizations. I want to strongly encourage some sort of dialogue about the opioid settlement dollars. They should be used to fully fund K-Trax to the tune of $850,000, okay? We're going to get that money for 18 years, and it is to prevent, it's to use for treatment and prevention of the opioid crisis, and K-Trax is something that is a legitimate, well-respected system to do that. So the reason I brought it up is because I do know that even in the Board of Nursing strategic plan, they talk about monitoring K-Trax funding because they're concerned that the legislature may come back and ask for fee funds to help fund K-Trax. K-Trax got a 3-year grant from the Department of Justice. I have it here on my desk. And that funding is now gone. So they're going to have to rely on SGF money, the opioid settlement money, to continue to fund the K-Trax in our state. The third thing I want to talk about, and I have talked about this repeatedly to the Board of Nursing, okay? They know that this is something that I feel strongly about. KSBN's goal is to have discipline cases resolved in 9 months at a 60% rate. In the last report I read, they were only at 53% of cases being resolved in 9 months, which means that 47% of their cases are lingering past 9 months, and that they are not meeting their own established goal. Greater attention, staffing and operations needs to be focused to try to meet the goal of 60%. In fact, I'd prefer it be 75%. I think nurses who are hanging out there, who've had a complaint against them, they shouldn't have to wait that a long time to have it resolved, either closed or some sort of disciplinary action, okay? Additionally, I do want to say that have someone has monitored the Board of Nursing, like myself, I have been very impressed the last 18 months with their activity. They have streamlined it. They are working hard, and the committee of the Board of Nursing who does this work used to meet every quarterly. Now they meet every month. They're looking at those cases or trying to move them along. So I have been impressed with Carol and Linda Davies, the staff member who's working on that. I believe that part of that new money that's coming in to help them upgrade their electronic systems may be for modules so that their investigative committee and all those files can move from paper to electronic, okay? That has been one of their absolute challenges over the years, okay? Absolute challenge, because they do everything on paper. So they've been trying to move it to an electronics. And Adrian is here, their IT person, and he's spoken about that as well. We just have to get them moving into the 21st century related to that. I know they're working on it. It's going to cost some money, and it's going to change the way they do their work. Last but not least, the Kansas Nursing Workforce Center. And I've attached some documents. What I've given to you is a matter of public record. And I was at the September Board of Nursing meeting when a representative from the KU School of Nursing talked about the Kansas Nursing Workforce Center. Starting it at the dean of the KU School of Nursing was supportive of it. They've talked with the Kansas Organization of Nurse Leaders, with the Kansas State Nurse Association, many groups coming together, nurse educators. What can we do to address, number one, what our demands are, and if we're going to meet the demands for nursing? What kind of data do we have? So they are working on developing a workforce center to be able to identify what our demands are in our state, based on population and diseases and chronic diseases and hospitalizations, so that we can do a better job of providing enough nurses to take care of the patients throughout the state. So I just wanted to bring to your attention that it's a worthy endeavor. I respect KU for taking this on, and that eventually it's going to need some funding. And I would hope that, because there's 40 states that have nursing workforce centers, and I happen to be a little bit more familiar than most people because my current president, her name is Jane Foote, she's in charge of Mayo Clinic's professional staff development. She used to work in Minnesota. She used to run the Minnesota Center for Nursing that did this work. Okay? It's important work, and 40 states have centers. I've given you a fact sheet that came off their website. I know that you're going to be hearing more about it, but it's an important endeavor, and I just wanted to say that I hope that in the future you will consider funding it and helping with the Nursing Workforce Center funding. Thank you.
Thank you for your testimony. Committee, do we have questions? Representative Hobson.
Thank you, Thank you, Mr. Chairman. With respect to the K-Track, you did say that they received a grant from the federal government with the
Yeah.
Department of Justice. Is that right? What was it?
Board receives 3-year grant to fund K-Track's enhancements. It's called the 2020 Harold Rogers Prescription Drug Monitoring Program Grant. And it was a 3-year grant totaling $975,489,000, and it ran through last year, and it was funded by the DOJ.
When you say last year, which is last fiscal year, is that?
I believe so.
Last fiscal year? Okay.
Yes, sir.
And you're saying it's gone, and right now they're.
It's gone. They did get, to the best of my knowledge, they did get 200,000. You guys, when you did the statute for the, what do you call it, the DFA, that money that's coming from the opioid settlement, you allocated 200,000 statutorily to K-Trax. It is also my understanding, I went on the Sunflower website, Sunflower Foundation website, and I read that the DFA board also allocated an additional 200,000, okay? Still not what they need to run that, okay? They still need another 400,000 to run K-Trax, but I'm not an expert on it. I'm just saying, I've monitored the opioid money nationwide for other things. I believe that we need to engage in prevention where it's reasonable and effective, and I believe that K-Trax meets that need, and that the opioid settlement is an excellent source of funding and should fund it in total. And quite frankly, I'm probably going to go to the DFA next board meeting and tell them that, okay? Because I'm pretty opinionated about this. Thank you.
Thank you, Mr. Chairman.
Any other questions? Representative Clifford.
I could not agree more with you about that. That settlement needs to fund K-Trax, absolutely, and you could use my name. DFA, tell me what that stands for.
The last word is addiction.
Okay, but it's under the Sunflower Foundation?
Sunflower Foundation was created by the Attorney General, just remember a little history here, from the Blue Cross and Blue Shield settlement from when Carlos Stovo was the Attorney General. So the Attorney General oversees essentially the Sunflower Foundation. And when the opioid settlement money started to come in and you all passed a bill, he then had to, he or she, the Attorney General said, I got to put that somewhere. He put it at the Sunflower Foundation for them to administer, okay? And I should have spelled out what the DFA was, but it's some abbreviation. But there is a statutory, you all passed a statutory law relative to creating that board, and he then had to implement it, so he handed it over to the Sunflower Foundation.
Thank you. I'd like to talk off channel about that because I'm very interested in where that money is going.
You and me both.
Thank you. Thank you, Mr. Chairman.
I did read that there's a recent article by a Wichita State graduate who wrote an article for one of the Wichita papers that talks about what she had knowledge about relative to the distribution of that money. So I'll get that to you.
Representative Ballard.
Mr. Chairman, being familiar with pharmacy and K-Trax, and you're absolutely right. At one point, in order to keep that program going, it was a valuable program, but we just did not have funding. I think at one point, a little bit of appropriations was given, and then after that, we did have to go not only to the nursing board, but additional
You did. Board of Healing Arts, all of them.
In order to
You're
do
right.
that. And, and I would just say, when I think of Executive Director, Ms. Blousey, one of the things that, they have always done is look for grants.
Mm-hmm.
And grants has sustained us in between all of the different funds we had. And we got to the point that we no longer needed those funds. And so, yes, I think that grant we knew about because we knew it was coming before we got it and everything else. So when I'm looking at that, That settlement you're talking about with the opioids,
$350 million.
well, I was about to sing for that. But, you know, when I look at that, I've never been sure where all of that money was actually going to go.
Oh,
But in terms of the
You and the rest of
valuable
us.
work that pharmacy has done
yeah.
in that area, I certainly would agree with you, opioid, they should get some of that money because it is statewide. And everyone benefits from the work that they're doing as well.
And it's effective.
Okay. Thank you, Mr. Chairman.
Committee will be hearing more about K-Tracks in the next presentation when we get to the Board of Pharmacy. So are there other questions at this point? Seeing none, we'll close this.
Thank you for your time.
Thank you. We'll close this budget hearing on the Board of Nursing, and we'll open up the hearing on Kansas Board of Pharmacy, and we'll get a review of the budget from Megan.
Good afternoon. I'm still Megan Leopold from Legislative Research. Excuse me. I'll be starting on page 1 of the Kansas Board of Pharmacy. The Kansas Board of Pharmacy is responsible for the enforcement of the Pharmacy Act and the Controlled Substances Act. They track prescribers, dispensers, and patient information for all scheduled substances and drugs of concern dispensed in Kansas. They license pharmacies and pharmacists, and they ensure compliance with drugs and regulations regarding the practice of pharmacy. I'm going to skip forward to page 6 and provide an overview of the agency's fiscal year 24 analysis. On page 6, you can see that the agency submitted a revised estimate of $4.3 million. This is all special revenue funds. Again, this is an agency that does not receive any state general fund funding. They requested 19 FTE positions in fiscal year 24. This is a decrease of $2,048,000 or less than 0.1% below the amount that was approved by the 2024 legislature. The revised amount includes the following adjustments. In the table at the top, you can see these adjustments itemized out. There's an increase of $83,464 in salaries and wages expenditures. This is largely due to salaries and wages increases in the agency's investigation program. The agency provided wage increases to bring those up to closer to the national average. They also had increased expenditures for employer contributions for Social Security and CAPERS included in that increase. You can see that there is a decrease of $40,000 in contractual services. This is largely due to decreased expenditures for attorney fees and computer programming. And there's also a decrease of $41,000 in capital outlay. And that was due to expenditures that were budgeted for a passenger vehicle in fiscal year 24 that they ended up spending in fiscal year 23. And you can see in the line below that the governor did not recommend any changes to the agency's fiscal year 24 estimate. On the next page, page 7, you can see the changes from actual expenditures in fiscal year 23 to fiscal year 24 revised estimate from the agency. There was an increase of $829,000 between the 2 years. This is a 23.8%. This is an increase of $194,000 in salaries and wages. There is an increase in contractual services of $658,000 and an increase in commodities of $22,000. The salaries and wages were largely due to that 5% salary adjustment for employees in fiscal year 24. And the contractual services increase is due to lower than anticipated expenditures for computer software and maintenance services and attorney fees in fiscal year '23. So again, this is an instance where there's an increase between the 2 years, but some of that is attributable to the fiscal year '23 budget being lower, the agency spending less than they were approved. Moving forward to page 8. This is an outline of the agency's fiscal year '25 request. The agency submitted a revised estimate of $4.1 million, and that's all special revenue funds, and 20 FTE positions for fiscal year '24. This is an all funds increase of $228,000 or 6% above the fiscal year '24 original. You can see in that table, line number 1, the agency had 3 enhancement requests. The first one is for a new FTE position. The agency is looking to add an assistant director position. That's within the compliance division of the agency for fiscal year '25. The agency has communicated this is largely due to increased workload within that program, due to an increase in complaints and investigations and the complexity in those. This position will relieve certain specialized duties from inspectors to improve their workload, as well as provide training and inspection to inspectors and staff. Line number 2, you can see that pay plan shortfall. Again, this is the same thing that we saw in the Board of Nursing fee fund. This is just a continuation of the pay plan that was implemented in fiscal year '24. It's raising the agency's expenditure limit so that they can continue that pay rate into fiscal year '25. Number 3, you see a hospitality fund increase. The agency has requested $500 to increase the expenditure limitation for the hospitality fund. This is a fund within the fee fund that is used to pay for lunches and other things during board meetings. The agency communicated this was last increased in fiscal year 2020. Below, you can see that the governor recommends expenditures of $4.1 million. In short, the governor concurred with the agency's request with one exception, and that is that the governor did not recommend increasing the hospitality fee fund by $500. What is included in the recommendation is that the agency's fee fund expenditure limit for that fund will go up. And again, the hospitality fee is included in the overall fee fund. There's just a limitation on how much the agency can spend on this particular expense. So the governor is recommending that that increase be raised, meaning that the agency can spend up to $2,500 or $2,500 on hospitality, but the governor is not recommending that that money be added. So it's asking the agencies to absorb it. And then as with the Board of Nursing, if you look back on page 3, you can see a chart that charts out the State Board of Pharmacy fee fund expenditures from 2016 into the governor's 2025 recommendation. And on the following 2 pages are the revenues and expenditures, as well as the ending balance for the fee fund and the licensing fees. I'm happy to stand for any questions.
Committee questions for Megan. Representative Hobson.
Thank you, Mr. Chairman. Could you explain that process again? You talked about the governor didn't want it to be added, the $500. Could you explain that one more time? I didn't quite get that.
So statutorily, the agency had been limited to $2,000 for hospitality. And so the language in the bill will change and say that they can spend up to $2,500, but that $500, rather than being an additional $500 added to the budget, will just have to come from the general fee fund. So they can spend more on this area, but they'll have to absorb it and just pay it from the general fee fund, should they choose to do that.
Committee, other questions? Representative Carpenter.
So Megan, on page 5, and this may be a better question for the agency, but all these fees are under the statutory limit except for the durable medical equipment provider license, and it's the same. I'll ask the agency that. Thank you. Thank you, Mr.
Last call, committee. Thank you, Megan. At this point, we'll call Alexandra Blasey, Executive Director of the Kansas Board of Pharmacy, to the podium. Welcome.
Thank you, Mr. Chair and members of the committee. I'm Alexandra. There we go. I'm Alexandra Blasey. I'm the Executive Secretary of the Kansas State Board of Pharmacy. You have my testimony. I'm going to try to make this as painless and in the interest of time, quick as possible. We absolutely concur with the governor's budget recommendations and appreciate the time that the Division of Budget and the governor have dedicated to our budget, not just this year, but over the years. As you've heard, K-Trax has been a topic of concern for many years, and I'm pleased to say that we are in a very stable position with K-Trax budget right now. One of the things I did want to highlight is that you can see on just that first page of the analysis there, the dwindling federal funds year over year. While that is a reality, federal grant funds are becoming less and less available, and they have more and more strings attached to them, which limit what we can apply for. We absolutely are continuing to seek those grant funds as we are able, and I'm pleased to report that while we cannot make it official in this budget yet, we have been awarded 2 additional grants, and we are working currently to finalize those. One is a new Harold Rogers Bureau of Justice Assistance grant under the Department of Justice, and one is a subrecipient agreement with the Kansas Department of Health and Environment related to the new opioid overdose data to action plan. Thank you. Sorry, it's 9 million words to say the CDC. However, the reality is that, as I mentioned, federal grant funds are becoming less and less, and so we are watching this very carefully. We are examining exactly how much money is coming in from other sources and recognizing that at this point, the Board of Pharmacy is supplementing the K-Trax program with Board of Pharmacy fee fund dollars. We're happy to do that, and we have worked on a revenue source that will help continue to support that. We will never say no to additional opioid settlement dollars. However, we are very grateful for the $200,000 transfer we receive every July 1st. And we have also been privileged to be awarded an additional $200,000 this fiscal year. So as I said, we are stable. We're working on that fee fund balance. Representative Carpenter, to your question, yes, we are within our statutory caps. If we had to raise fees, we could do that. However, we'd like to prolong our current fees as much as possible. The last time we raised fees was in 2019, I believe. And some of those were quite substantial hikes at that time. So we have some space that if we need to increase to help balance the fee fund, we could do that. And we would be able to do that by regulation at this time. With that, I'd be happy to stand for questions. As I said, my testimony is lengthy and does draw attention to some of our really excellent performance measures, but I will let you read that in your own time.
Thank you very much. Committee questions. Representative Carpenter.
So just to follow up, that really wasn't my question. Why is that at the cap and the rest of them aren't?
The durable medical equipment, I believe we did not adjust that cap the last time we had a bill go through. We kept it as it was. The durable medical equipment facilities really range from large corporations to a small mom and pop shop. So we want to be very reasonable about the cost there, and we just didn't increase the statutory cap.
Okay, thank you.
Representative Ballard.
Thank you, Representative Ballard. I'm afraid I may disappoint you a little bit this year. Unfortunately, well, let me back up. So the unused medication donation program has been operable in Kansas for a long period of time. It continues to remain operable. However, the very large company that had been the primary donor of that program has since needed to make some changes to the way their program has operated. So we are currently in the process of working with them and with the Drug Donation Depot to identify how that process can work moving forward, and if there's a different mechanism for them to be able to donate within their current processes. In addition, we are looking at trying to revamp that regulation to actually expand the program so that there are some other entities that may be able to become donors in the future. So more to come on that, hopefully next year. This time I will be able to provide more of an update there.
I'm trying to remember, Mr. Chair, I'm trying to remember from last year, but approximately how much have we actually saved the state of Kansas?
Yes, I believe it's upwards of $40 million over the lifetime of the program.
You know, and I ask that question often because a lot of people maybe not understand that this was a matter of making some changes so that this medicine can be used and saved. I mean, over 40 million for people out there. I mean, that is not small change. It's valuable for those that need that medication, and pharmacy played a major role in doing that as well. I made the comment that you've always, in all the years that you've been before this committee, sought grants. And you just verified again this year, you have 2 coming in. So, you know, the success of the K-TRACS program has been lots of people contributing, but mostly pharmacy, making it happen, taking the time and using your expertise to get these grants, which saves the state of Kansas a lot of money, but at the same time puts an awful lot of stress on you and your staff as well. So I'm hoping we'll eventually get to that point that there's enough money. We don't want more than you need, but enough that you don't always have to. But it is good to always have grants because it says the quality of your program speaks for itself. So thank you very much.
Representative Clifford.
Thank you, Mr. Chairman, and thanks for the K-TRACS report. This is your product?
Yes.
Yeah, it's
It's put
interesting.
together by our Assistant Director of K-TRACS, Gail Donaldson, right here. She does an exceptional job.
As someone who participates, and I have a DA license, I wonder, are the number of prescribers with DEA license renewals dropping because they have made it really difficult? We have 8 hours of training, CME every 3 years on top of our 50 hours a year we already have. And I know my 2 partners in practice have dropped their prescribing of opiates. So part of it's education, and that's useful, but part of it's they're making it hard to do. For every Medicaid patient to whom we prescribe opiates, we're required to to look at K-TRACS and have it in the record. So, and our licenses are subject to scrutiny on whether we have that behavior. So it's been an interesting process, but I wonder, just to answer that one question, are the number of folks accessing DEA-type licenses decreasing?
I'm going to look back at my Assistant Director and see if she happens to know the answer to that question. We could get you some numbers. I'm not aware that our numbers of prescribers that are participating in K-TRACS is decreasing because of that, but we encourage them to participate in having a K-TRACS account regardless of whether or not they're still prescribing using a DEA registration.
That's certainly increasing, but I'm sure all
Yes.
these folks don't have prescriber licenses. So, yeah, I would be interested in that number. Thank you. Thank you, Mr. Chairman.
Committee, further questions? Representative Droege.
Thank you, Mr. Chair. Thank you for your testimony. This is not quite on here, but I was looking at this compliance performance measures, and you have complaints, and roughly half of them lost their license in year to date. I was wondering what kind of complaints those were that caused the license loss. Are they misdirected drugs, or what kind of thing are they?
I'm not sure I'm following exactly which line item in the table you're referring to.
2023 year to date, number of complaints received 112.
Okay.
Number of license removals is what, 61?
Yes, I can explain that. So when we are counting the number of complaints received, those are consumer complaints that are referred into our office. We actually receive a complaint. Not all of those result in any kind of disciplinary action at all. Many of them are closed and no violation is found. Those number of revoked licensees or registrants, that could have stemmed from any number of things, not just a complaint. So most of those, if not all, if memory serves, are actually pharmacy technicians. They are individuals in the pharmacy that assist the pharmacist. Most of those revocations occur primarily because of either drug diversion or a failure to correspond with the board related to their license.
On the drug diversion part of it, I see that they lose their license, but do they get reported to authorities and prosecuted?
In some cases, yes. That actually usually comes directly from the pharmacy itself if they refer them to law enforcement, and cases are often brought against those individuals. They are, I will note, a revocation in Kansas is not permanent, so they can seek reinstatement of their licensure after 1 year. Of course, they would have to demonstrate rehabilitation and appropriateness to be back in the profession at that time.
Thank you.
Further questions, committee? I do have one. You have 19 FTEs authorized by statute. Of those, are there any that are vacant?
We have one vacancy right now, Mr. Chair. We recently had an internal promotion that resulted in a domino effect. I think that's actually an excellent thing that we were able to promote from within our own agency. There were actually 2 dominoes in the process, and so that has resulted now in one vacancy that we are actively receiving applications for.
That answers my question. Thank you. Committee, seeing no further questions, thank you very much for your presentation.
Thank you, Mr. Chair.
We'll close that portion, that hearing on the Board of Pharmacy, and we will move to the hearing on Kansas Board of Mortuary Arts. And for that, we'll have Fiscal Analyst Amanda.
Good afternoon, Chair. My name is Amanda Prosser. I'm with Legislative Research. In front of you, you have the Board of Mortuary Arts budget. Looking right at this first table, you can see that the governor is concurring with the agency's revised estimate of expenditures for 2024, which is that $332,594. That is the same amount that the legislature approved last session. You can also see that the governor concurs with the agency's revised estimate for fiscal year 25. That 25 number includes an increase in expenditure limitation of just under $10,000 from the Mortuary Arts Fee Fund to account for the pay plan that Megan mentioned earlier. Beyond that, I do want to draw the committee's attention to page 6. The agency is in process of increasing their fees. As you can see in this table, they're still well within the statutory limit for those fee increases. Individual licensees renew biannually and establishments renew annually. Knowing that, the agency estimates that these fee changes will increase their total revenue by approximately $67,000 this fiscal year and $58,000 in 2025. Chairman Mason, that really concludes my presentation. The Executive Secretary, J.W. Carey, is here if you have any additional questions for the agency.
Thank you, Amanda. Committee questions?
I like it.
I'm seeing none. Thank you, and we'll close that hearing on Board of Mortuary Arts. Now, committee? No. Oh, I'm sorry. Oh. We didn't have you on here. I'm sorry. Well, please tell us who you are and give us your spiel.
Thank you, Mr. Chair. My name is J.W. Carey.
Okay. All right, questions for the conferee? Representative Ballard.
Got up, you're gonna, I'm gonna give you something, right? Yes, I'll tell you that. Thank you. You know, there was a time when the state really contributed so much towards burials, embalments, and cremations and all. What do we contribute to it now?
To my knowledge, nothing. There is
May I follow up on that? What happens if we have a homeless person and, who's responsible to claim the body, and what happens to that individual if they don't have family or anyone watching out for them?
If there is no family or anything like that,
Thank you, Mr. Chairman. That's a sad scenario. Everybody, regardless of who they are, deserves.
Committee, other questions? Well, thank you. I'm sorry for the confusion, but I appreciate you standing up and being willing to stand for questions. Thank you for appearing. With that, committee, the next part of the agenda is the recommendations on these three budgets. So I will start with the Board of, whoops, what we got here? Yes, that'd be fine. Please, I'm going to have Megan answer a question for Representative Barth.
I just wanted to quickly address your question about the change in fiscal year 23 and 24. So this is in the Board of Nursing analysis. It's page 8. And it is looking at the change from the actual expenditures in fiscal year 23 to the agency's revised estimate. And there were $369,000 increase in salaries and wages. So on one hand, the agency spent about $160,000 less in fiscal year 23, largely due to vacant positions. And then there was an additional funding in fiscal year 24 that inflated that salaries and wages budget because of the pay plan. There were also some increases for Social Security and health insurance in fiscal year 24. There was a $715,000 increase in contractual services, and that's because the agency is expecting to pay more for computer programming services. This is part of that IT plan that we discussed as they move forward in their and updating their licensing system. There was a $5,400 decrease in commodities. And that's largely due to a decrease in expected expenditures for data processing supplies and office supplies. And then there was a decrease in capital outlay of about $300,000, and that is decreased expenditures for software, office furniture, and other capital outlay items.
Barth?
Thank you. Before the 300,000 capital outlay, what was the previous number and what was it for again?
Do you want the numbers? Like, I can show them to you if you want to add. Are you making sure they add up? Yeah.
I'd like to see it.
So it's 369,205 in salaries and wages, and that's an increase. In contractual services, there's an increase of 715,109. For commodities, there's a decrease of 5,461. Okay. 5,461.
Only 5,000?
Mm-hmm.
61, okay. And that was for what one?
That's commodities. Did you get the capital outlay?
300,000.
It's 299,841.
369.2 was the first number.
Okay, thank you, Megan. Okay, committee, I will accept recommendations on the budget. Let's take this year by year. We have 24 and 25 for the Board of Nursing. Committee recommendations? Representative Ballard.
Well, I would just move that we concur with the governor's budget
For both?
for both. Yes.
I'll second for both if you need a second, Dr. Clifford.
I do. Committee discussion on this motion. There's a motion to concur with the governor's recommendation for both fiscal year 24 and 25.
And Mr. Chairman, I'm going to make sure that that does include that the pay plan that's included in
The shortfall?
shortfall.
I think that's standard throughout.
All right, just wanted to make sure.
Committee discussion? Seeing none? All in favor of approving fiscal year 24 and 25 for the Board of Nursing, say aye.
Aye.
Opposed?
No.
Okay. Motion carries. Now let's look at the Board of Pharmacy. Again, a 2-year budget. We have fiscal year 24, 25. I would accept recommendations for those 2 years.
Chairman, I move that we accept the governor's recommendation for the Kansas Board of Pharmacy for fiscal year 24 and 25.
Second.
We have a second by Representative Ballard. Discussion on that motion. Seeing none, all in favor of the Clifford motion to accept the budget for fiscal year 24 and 25 as governor's recommendation, say aye.
Aye.
Opposed, no. Okay, that budget is approved. And finally, we have the Board of Mortuary Arts. Again, I would accept recommendation for fiscal year 24 and 25. Representative Barth.
I actually had a question about, didn't realize we were voting on this already, around the increase of the licensing fees and the justification of increasing that over $60-some thousand. I know that this is a pretty tight market of folks that provide these types of services, so before making that increase in recommendations, I'd like to have some discussion, even with a constituent of mine.
We can entertain that
Mr.
question.
Chairman, point of order, would you like a motion to put this on the table so we can have the discussion?
That'd be fine. Let's do that.
So I would move to accept the governor's recommendation for the Kansas State Board of Mortuary Arts for fiscal years 24 and 25.
And I second it.
All right, now we'll have the discussion. Thank you.
Yes, so I just question about the fees and the increase and the justification. I know it was some $60-some thousand, but what would that be going towards, and what is the reason for increasing it? I know this is a very specialized market with only a certain amount of folks, and was hoping to have some time maybe to even talk with one of my constituents that is in this business.
Mr. Carey?
Just making sure that's on. Yes, your question is mainly based on why are we increasing the fees? Okay, because we haven't had a fee increase in roughly 13 years. And our fee fund is getting low to the aspect of we need to increase fees. The other thing is that, hold on just a second. You're looking at a proposed fee increase basically on embalmer and funeral directors biannual license and renewal fees. These will be increased by $60. That is a 35.7 and a 26.3% increase. Now, I would like to go ahead and spread that over 13 years. For the embalmer's biennial license renewal fee, that is only a 2.7 increase over 13 years. And for the funeral director's license, it's a 2.02 increase. I'll be happy to answer any other questions, Representative Barr.
Yeah, hang on just a second. These are statutory caps, so there's really not a budgetary issue that we can determine that they can or cannot raise this. They have that authority. Representative Ballard.
Thank you. That was one of the reasons I asked, what does the state contribute to that? This is a fee fund, and everything you do, you have to pay for it yourself, basically.
That is correct.
And if you don't raise it, I think it's interesting, and I was going to bring up 13 years. That's a long time not to have an increase. People die every year, you know, and yet those people do not have it. And I do know that with embalmers and funeral directors, that often they do a lot in gratis. In other words, they're not charging a whole lot for what they do. So if you don't get it out of fees, it's very difficult because you don't have family members and you don't have other sources in order to pay. Thank you, Mr. Chairman.
Representative Clifford.
Thank you, Mr. Chairman. Have you consulted your stakeholders regarding these increases? Are they going to come as some surprise, or people have been expecting this for years, or?
What we will do, as a matter of fact, I have just delivered to the Secretary of State. We're going to have a notice of public hearing that'll be presented here in the next Kansas Register. We'll start our 60-day comment period after February 1st.
Thank you. Thank you, Mr. Chairman.
Committee, further comments, questions, discussion? All right. Getting back to the Clifford motion to approve the budgets as presented and the governor's recommendations, all in favor signify by saying aye.
Aye.
Opposed, no. Okay, we'll consider those three budgets as passed. Thank you, committee. We have a hearing again tomorrow, and I will see you then. We are adjourned.